everyone. Welcome to our Honors 102 Praxis project. Our team decided to focus on COVID-19 vaccine distribution of information to those who have been disproportionately affected by COVID-19 over the past year.
Yeah, so in our needs assessment, we observed a problem in the DeLand community, which was COVID-19 vaccination barriers. And the people who were most affected by those barriers were minority and immigrant populations. And so to figure out the specifics of what those barriers were and what we could do to fix them, we had an interview with Dolores Guzman, who was the former commissioner and advocate for the Volusia County Health Hispanic community. And so after meeting with her, we boiled it down to a couple of main concerns. The first being the lack of public health education, the second being language barriers, the third being general misinformation surrounding the COVID vaccine and COVID-19 itself. The fourth being lack of access to COVID-related resources for minority and immigrant communities, and lack of transportation to vaccination sites for these populations as well.
So for our project, we wanted to give people in the Hispanic and immigrant community of DeLand some information that would empower them to get the vaccine. We were aware that many people don't have access to technology where you could register, and some people just don't even know how to go about registration. And even once they're registered, a lot of people don't have transportation to vaccine sites. Which, a lot of people don't even think that to be an issue, but, when you don't have a car or, money for the bus, that's something to think about. And we also want to spread information about the vaccine because we understand that there's a lot of misinformation out there, a lot of myths. So we focus on debunking those myths. So the goal for the project was to create an informational brochure that highlights all the things I just talked about. So it has a section about debunking vaccine myths, like can you get COVID from the vaccine, which obviously you cannot, but these are the kind of things that, if you don't have access to resources, how would you know? So there's also information on how to register and how to get transportation. And our goal is to connect people in the community to individuals like Dolores or people at the Hispanic health initiatives that have those resources available. So we were able to partner with the Hispanic health initiatives and also the local health department who helped us put out the brochure.
All right, so a timeline on how our project went was on February 24th, we met with community partners such as Dolores Guzman and Peter Williams. And from there, we talked about, what does the community need? And that's when we came up with the idea of a informational brochure to hand out. And by March 22nd, we had the brochure created and we gave it to Dolores, to which by April 3rd, Dolores had gotten approval by the health department to have it signed off, which was something we didn't realize was going to happen. So it was really nice and beneficial. And then on April 9th, we were able to start distributing them out into the community. And so roles each of our team members had was Nicole. She was there for translation because she speaks English and Spanish, so that was a huge benefit to us. And she also helped, and she was one of the main ones to help with the distribution of the brochures. Hannah was one of the main ones to do research in the brochures just to make sure we were getting all factual information. Madeline was one of the main ones to help design the brochure to make sure the brochure looked nice. And she also communicated between Dolores and Peter about what they thought on our brochure, how they liked it. And Casey also helped Madeline with designing the brochure, and Casey as well helped Nicole with community outreach, just to, make sure people needed it and it was a useful thing. And myself, I worked with Hannah and I researched, and I was going to ask Enter about our stipend requests before the health department approved this.
So our goal was to give easy access to both English and Spanish speakers about why to get vaccinated. We approach it with convince a few, help the masses. So even if we convince a few people to get the vaccination or to feel more confident in getting their vaccination, it'll overall help the general population in ending the pandemic. And while a brochure about COVID may not be sustainable because the hope is that COVID will eventually come to an end, the brochure is just a baseline of information that can easily be updated as new information comes out or new information on COVID is released.
Hello, my name is Nicole Garcia, and I'm quickly going to go over the successes and obstacles of our project. So first of all, we were so grateful to work with our local health department and have their seal on our brochure. In a way, it legitimized our information so we could give it out to the public. We were also glad to distribute a lot of the brochures to our Hispanic communities and just educate them about the vaccine. Some obstacles we had was just creating the brochure and deciding which information was best for our Hispanic community and which information they needed about the process of the vaccine. Another obstacle we had was deciding where to give out the brochures. We knew that big companies such as Publix or Winn-Dixie did not have as much Hispanic community going there. So we decided to target some of the local stores around the DeLand area and De Leon Spring area. So we decided to give them the brochure so we could distribute it throughout the Hispanic community more effectively. This was our presentation. I hope everyone liked it. If anyone has any questions, you can contact me or any other of our members, and we will gladly answer your questions. Thank you.